You're listening to FraudFeed, your finger on the pulse of the latest news and trends in insurance fraud prevention. Brought to you by the Coalition Against Insurance Fraud.
Hello, this is your host, David Veach, coming to you with FraudFeed. Imagine you're going into surgery. You've been told your operation is covered by your health insurance policy. You're stressed enough by the surgery, so it's a good feeling to know you recovered. Until you wake up. Soon, to your shock and surprise, you're handed a whopping bill for tens of thousands of dollars. You're told to pay the bill yourself, out of pocket, completely. Maybe it's for the anesthesiologist, x-ray doctor, or some other specialist. Where did this bill come from, you're wondering? You've just been ambushed. It's an expensive practice called out-of-the-network billing, and it can gouge innocent patients out of big money. It's happening a lot more often these days. Out-of-network, and you're out of luck.
Mark Scherzer is a consumer advocate and attorney in New York. He explains.
Often that information is contained buried deep in a plan document that people tend not to read very carefully because they have trouble dealing with these technical concepts.
Consider the misfortune of Peter Dreyer. He had neck surgery for what he says was an agreed price, but then he was blindsided by a bill of about $117,000. It was for an assistant surgeon who Dreyer didn't even remember meeting. Now look what happened to Ann Winters. Her son fell at home and hurt his mouth. Winters then took her son to the hospital for 3 stitches in his lip. The repairs just took 60 minutes in the emergency room. Winters soon received a bill for a whopping $50,000. Surprise medical bills like these can be abusive or even outright criminal fraud. Here's how out-of-network bills work against you. Let's say you need a surgery or other procedures. You call the hospital or clinic. You're told the facility belongs to your insurance network. Seems like you're insured. You've done your homework. What a relief. Then you go home after your procedure. Then these bills start arriving, and they aren't covered by your health policy, and you have to pay up from your own pocket. Where did that come from? Where's your coverage? In fact, you're only partly covered. The hospital or clinic never told you in advance. You had zero chance to shop or compare.
James Quiggle is with the Coalition Against Insurance Fraud. He tells us more.
You might have surgery for an appendectomy or other condition. Then you wake up and find yourself billed for all kinds of procedures that you had thought were covered by your insurance plan. This can be a tremendous surprise and shock because you thought you were covered, and now you may be on the hook for potentially thousands of dollars in unexpected bills.
Sometimes doctors are called in when a nurse or medical assistant can easily do the job, or there's a second surgeon involved who may or may not be needed either. Sometimes there are cadres of assistants, therapists, and others. They may or may not be needed. And guess what? They aren't in your insurance network and aren't covered by your health policy. The bills can be 20 or more times the norm, draining your bank account. If you refuse to pay, you could be hounded by bill collectors who threaten lawsuits. Some people have gone bankrupt from the huge bills.
Unpaid medical bills are probably the major cause of consumer bankruptcy in this country. It affects their credit rating, they have to make choices between paying their medical bills and often paying rent, utilities, and food.
Often you're just handed a big stack of consent forms to sign, full of fine print. Then afterward, you're handed something else, large bills, and told to pay the money. You're really over a barrel if you're rushing into the emergency room. You may be full of tubes or just plain sick, lying on a gurney. You're in no position to shop around and make sure you're fully covered. Giving childbirth? That large bill you get is hardly a cuddly bundle of joy. And sometimes, these deals involve insurance fraud. Medical providers may pay illegal kickbacks or bribes so they can get in on the billing action.
Some out-of-network deals can involve fraud through illicit kickbacks. Maybe a surgeon bribes another member of the medical team to be able to join the team. And this means you're putting profit potential and income over the patient's ability to receive proper healing and treatment.
So, how can you keep from being ambushed by surprise medical bills? Some states require health providers to tell you in advance of insured billings that could be coming your way. Make sure you ask and find out. Well, that's all very helpful. Though how can you personally protect against surprise billings?
Ask. Ask what it's going to cost. Ask if the doctor's in the network. If the doctor's not in the network, ask if you can see someone who is in the network. Make sure you are getting as accurate information as possible and double-check it.
First, be alert. If you have time, ask in advance what insured billings you'll have to pay and how much money. Get a signed and written agreement. Second, shop around for the best deal that's covered by your health policy. And third, if you've already been stuck with bills, then appeal to your insurer. Request that the insurer pick up the extra tab. It's possible the insurance company will give you a break. And getting that break sure beats going broke. This has been your host, David Veach.
This has been FraudFeed, brought to you by the Coalition Against Insurance Fraud. Find more resources and listen to past episodes at insurancefraud.org. For questions or comments, email coalition@insurancefraud.org. We value your feedback. Please consider leaving us a review. And if you like this episode, don't forget to subscribe to our podcast feed or follow us on SoundCloud so you never miss a show. Thanks for tuning in.